Hi, everyone. Today I want to talk about something that many men over 60 quietly wonder about, but rarely ask out loud. Is it still safe to touch yourself at this age? I'm a urologist, and I've met hundreds of older men who ask the same question. Does masturbation affect my heart, my prostate, or my sexual performance? And the truth is, it's not as simple as you might think. In this video, I'll reveal what most people never hear from their doctors, why understanding your body and doing it the right way can actually support your health, boost your confidence, and when it's time to seek medical advice. Make sure you stay until the end, because I'll share 3 golden rules that help men over 60 keep their sexual health safe, comfortable, and scientifically sound. But before we get into how to do it safely, let's first understand what really happens to a man's body after the age of 60. As we age, our bodies change. That's something we all know. But what many men don't realize is how deeply those changes affect sexual health. After 60, your testosterone levels naturally begin to decline. That doesn't mean your masculinity disappears, it just means your body is adjusting to a new rhythm. Lower testosterone can lead to less frequent erections, slower recovery time, and sometimes a reduced interest in sexual activity. But here's the important part: these changes are normal, not a sign that you should stop caring about your sexual health. You see, sexual function is closely tied to overall well-being. Studies from institutions like Harvard Health have shown that moderate sexual activity, including safe masturbation, can help maintain healthy blood flow, reduce stress, and even support sleep quality. When blood circulation improves, it benefits not only your sexual organs, but also your heart and brain. It's part of keeping the entire system in balance. Another key point is nerve sensitivity. As men age, the nerves involved in sexual stimulation can become less responsive. This means it may take longer to reach climax or require more direct stimulation. Some men find this frustrating, but in reality, it's an opportunity to slow down, focus more on sensation, and reconnect with your body. Hormonal shifts can also impact mood and confidence. Feeling anxious about performance or physical changes is common, but it's essential to remember that intimacy and pleasure are lifelong experiences. There's no age limit to caring for yourself or enjoying healthy touch. When approached with mindfulness and safety, masturbation after 60 can actually be a way to maintain body awareness and emotional well-being. It's not about chasing performance, it's about staying connected with yourself in a healthy, respectful way. So now that we understand what's happening inside the body, let's talk about how to do it safely and the common mistakes men over 60 often make without realizing it. Now that we understand how aging affects the male body, let's talk about the right way to keep things safe, comfortable, and healthy. Masturbation after 60 isn't about performance or frequency. It's about understanding your body's limits and treating it with care. The first principle is gentle and slow. As men age, the skin and blood vessels around the genitals become more sensitive and fragile. Strong or rushed stimulation can sometimes lead to irritation or small injuries. Taking your time allows better blood flow and helps you enjoy the process without unnecessary strain. Remember, this is not a race. It's a way to relax, relieve stress, and connect with your body. Second, always use proper lubrication. This may sound simple, but it makes a big difference. A water-based lubricant can reduce friction, prevent dryness, and lower the risk of micro-tears or discomfort. Avoid using household products or oils that can irritate the skin or damage condoms if you use them. Some men find that warming up the lubricant slightly or experimenting with texture can help increase comfort and sensation. Third, create a relaxed environment. Emotional state matters more than many realize. If you're tense, anxious, or distracted, your body won't respond as well. Choose a calm time, perhaps after a shower, when you feel relaxed and free from pressure. Breathing deeply and staying mindful can actually enhance pleasure while reducing strain on your heart and muscles. Now, let's talk about common mistakes. One frequent issue is using positions that put too much pressure on the lower back, groin, or pelvis, especially for men with prostate or circulation issues. Another mistake is overexposure to highly stimulating adult content, which can lead to unrealistic expectations and fatigue. Your body doesn't need constant intensity, it needs balance and awareness. If you ever feel pain, numbness, or notice changes in function, that's your body asking for attention, not punishment. Listening to those signals is a form of self-care, not weakness. Up next, let's go over the warning signs that mean it's time to see a doctor and how to know the difference between normal changes and something that deserves medical attention. Even when you're careful and doing everything right, it's still important to know when to reach out for professional help. After 60, the line between normal age-related changes and early signs of a medical issue can be subtle, and paying attention can make all the difference. Let's start with some of the warning signs. If you experience pain during or after masturbation, burning when urinating, or notice blood in your semen or urine, those are not things to ignore. They don't always mean something serious, but they're worth checking with a urologist. These symptoms can sometimes be related to prostate inflammation, infections, or circulation issues that are easier to manage when caught early. Another red flag is persistent erectile difficulties. It's completely normal for erections to become less frequent or firm with age, but if you notice that it's consistently difficult to get or maintain one, even during arousal or with morning erections, it may indicate a blood flow or nerve problem. In many cases, that's not just a sexual issue, but a potential early signal of heart or vascular disease. Think of it as your body's internal warning system, not something to be ashamed of. Also, if you ever feel numbness or a loss of sensitivity, don't dismiss it. That can be related to nerve changes, diabetes, or medication side effects. Your doctor can help you sort out which one and suggest safe adjustments or treatments. Seeing a urologist after 60 isn't about fixing something that's broken. It's about maintenance, the same way you'd check your blood pressure or cholesterol. Many men find relief simply from understanding what's normal for their stage of life and what's not. A quick consultation can often provide reassurance and prevent small issues from becoming bigger problems later. Taking care of your sexual health is part of taking care of your whole self. It's about comfort, confidence, and longevity, not perfection. So now that you know how to stay safe, aware, and confident, let's wrap this up with one final message: how embracing your body at any age can actually lead to a healthier, happier life. Aging doesn't mean the end of intimacy or pleasure. It simply means your body communicates in new ways. When you approach self-care with awareness, patience, and respect, it becomes more than a physical act. It's a way to support emotional balance, blood flow, and overall well-being. Remember, healthy sexuality is not about performance or comparison. It's about understanding your body, listening to its signals, and caring for it with the same attention you give to your heart, diet, or sleep. If you ever notice changes that concern you, reaching out to a healthcare professional is not a sign of weakness. It's a smart step towards staying strong and confident. The truth is, men over 60 can continue to enjoy a safe and fulfilling connection with their bodies. Science supports it, and experience confirms it. By keeping things gentle, mindful, and medically informed, you're investing in your long-term vitality, both physically and emotionally. If this conversation helped you understand your body better, don't forget to like, subscribe, and share this video. And tell me in the comments, what's one thing about aging and sexuality you think more men should talk about? Stay informed, stay confident, and I'll see you in the next video on men's health and aging.